Big debates this weekend surrounding Medicaid. New analysis receiving a lot of attention from the Congressional Budget Office. The CBO saying the current version of President Trump's big, beautiful bill will add $2.4 trillion to the federal deficit over the next decade. We'll get to the latest on the politics of it all in just a moment, but some Senate Republicans this weekend concerned the Medicaid cuts go too far. The CBO saying the number of Americans without health coverage would increase by 10.9 million by 2034 if the current version of the bill becomes law. Bill Hanna is Wisconsin's Medicaid director appointed by Governor Evers. Bill, welcome to Up Front.
Thank you. Thank you for having me.
And so we will talk about the numbers here in just a second, but let's start with what Speaker Valls just told Matt there, that this is all an exaggeration from Democrats and there will be no cuts to Medicaid in the current plan. How do you respond to that?
So we absolutely know there will be individuals impacted by what's included in the House bill. We estimate today there are about 63,000 individuals that are not currently meeting the work requirements as they are set. Those individuals, if they don't make changes right to their behavior, will certainly lose their Medicaid coverage, increasing the uninsured rate in this state.
Why do you think that there's this divide of Robin Vos saying that this is all political and that this is just an exaggeration on behalf of Democrats?
I think there's a lot of nuance. There's a lot of specificity. Medicaid's a complicated program. And I think the bill doesn't get specific enough and that the impact is maybe broader than intended. I think we can look at and think about who's going to be impacted by what's in the House bill. Let me give you one real clear example that somebody would not be excluded. We know that individuals 55 to 64 are the least likely to be working and on Medicaid, but that doesn't mean they're not contributing. You think about somebody who is caring for their grandchildren so that their adult child could work. We know child care is a challenge in this state. That individual would no longer be eligible for Medicaid. They would have to stop caring for their grandchild and go find a job so that they can maintain their Medicaid. I think that specific, that detail is really important in this conversation instead of broad sweeping generalizations that nobody will get hurt.
How many people in Wisconsin do you estimate would lose Medicaid coverage and why would they lose that?
Yeah, right now, we're taking out a snapshot of sort of with the data we have today, it's about 63,000 individuals that currently would not be meeting the work requirements with the data we have today. Again, we're not predicting on how people would change their behavior because of the bill, but they are currently not meeting the 80-hour minimum requirement that's included in the bill.
And that would force those 63,000 Wisconsinites to do what?
They either need to meet the work requirements, send in additional paperwork to meet one of the long list of exemptions that are in the bill, or ultimately, if they do not meet the work requirements and or do not meet the exemption requirements, they would become uninsured. They would not be eligible to buy health care on the exchange.
And why is that?
The technical rule is that they had access to Medicaid, and if you have access to Medicaid but for the work requirements, you are not eligible for subsidies on the marketplace.
There's some administrative costs with this for the state. How much do you anticipate that this will cost the state under the bill as it's currently written?
Yeah, in the first full year of implementation, we expect it to cost the state about $8 million, total state and federal dollars, $18 million. This requires a lot more work for all of the workers that determine eligibility in all of our 72 counties to process all the new documentation that's required to implement the work requirements, educate folks about their new responsibility if the bill passes.
And how would that be paid for, $8 million coming from the state?
Yeah, we are in conversations right now, right? There's a lot of unknowns on what exactly the final bill will look like, having conversations with the Legislative Fiscal Bureau and legislative leaders about how does Wisconsin plan for this contingency should this bill come to fruition and what we would need to continue the program, the well-run program we have today.
Have you had conversations with the governor or his office or even other state lawmakers?
We've been having lots of conversations in Madison, especially with our colleagues in the Fiscal Bureau who sort of collectively work on finalizing numbers for both legislature and the governor to come to some agreement on how much we need to set aside to continue to run our well-run program.
You've also looked at the potential impact on SNAP benefits, the potential to transfer the burden to states. What would that look like here in Wisconsin?
Yeah, that's a much bigger cost shift to the state. First, it changes the share of administrative costs for food share. Today, it's a 50-50 split between the state and the federal government. The bill changes that to a 25-75, where the state has to pick up 75% of the cost. Right there alone is $51 million for the state to pick up just to run the program as it is today. The other change is, for the first time, the benefit cost, the amount that actually goes to food share recipients, historically has been 100% funded by the federal government. It adds, at a minimum, a 5% match for all states. That's $69 million a year in Wisconsin. And as the state's error rate goes up, so does the matching rate to the state, all the way up to 25% if their error rate is over 10%. Wisconsin has a very low error rate. We're 6th in the nation. We are under the current threshold, although other provisions in the bill put us at risk for a much higher matching rate, up to over $200 million annually, just to maintain the benefits that we have. Not to mention the additional costs associated with expanded work requirements for the food share population.
Bill Hanna, the Wisconsin Medicaid Director, thanks so much for being here. We appreciate it.
Thank you.
Up next, fireworks in Washington. Republican opposition to President Trump's big, beautiful bill. Elon and the president declaring war on social media. Senator Ron Johnson at the White House. ABC News Washington Bureau Chief Rick Klein with it all next.